Headlines at this hour. Global efforts stepped up to fight COVID-19 pandemic. Prime Minister Modi takes part in virtual G20 summit. Chair of G20, King Salman, calls for an effective and coordinated unified response, urges G20 leaders to offer helping hand to developing nations and restore confidence in global economy. Union Finance Minister announces slew of measures to ensure no one goes hungry across the country. Announces 1.7 lakh crore package for next 3 months. Pradhan Mantri Garib Kalyan Ann Yojana covering 80 crore people to provide additional 5 kg rice or wheat and 1 kg pulse over and above the current allocation. Finance Minister announces 50 lakh insurance per healthcare worker as a medical insurance cover for the 3 months. 8.69 crore farmers to be provided installment of rupees 2,000 in the first week of April through direct cash transfer, or senior citizens, widows, divyangs to also get rupees 1,000. Centre and states announced series of measures to ensure adequate supplies of essential commodities during lockdown. Union government allows doorstep delivery of medicines. Delhi Chief Minister says e-commerce companies to be facilitated. Essential shops allowed to remain open round the clock. Total number of active COVID-19 cases in the country rise to 633. Health Ministry says there is a reduction in the rate of increase. 16 people meanwhile succumbed to the disease, while 44 have been discharged after treatment. On request of Health Ministry, work begins in 17 states for COVID-19 dedicated hospitals. And share markets Share markets tally attempts continue as Sensex rises by over 1,400 points, while Nifty crosses 8,600 points at closing. Nasdaq jumps 2.2%, while Dow Jones Industrial stuck up at 2.7% gain, up more than 550 points. Namaskar and welcome. You're watching Doordarshan, nation's leading and national news broadcaster. I'm Sakal Bhatt, and the top story at this hour. Prime Minister Narendra Modi has participated in a G20 virtual summit to discuss issues related to coronavirus. World leaders began online crisis talks on the coronavirus pandemic that has forced 3 billion people into lockdown and claimed more than 21,000 lives. During the session, King Salman says the world's biggest economies must take firm measures on several fronts to combat coronavirus outbreak. He said this meeting of leaders of the largest economies in the world is being held to confront the pandemic by taking firm measures at various levels. King Salman called for coordinated and unified response. Meanwhile, Russian President Vladimir Putin, French President Emmanuel Macron, Chinese President Xi Jinping, US President Donald Trump were among the leaders who participated. And my colleague Abhishek is joining us with more on phone line. I believe the breaking news that we have is that meeting, in fact, of the G20 leaders has finally concluded. Abhishek, over to you. What has been the overall outcome of it in terms of coordinated and overall response globally to contain coronavirus outbreak?
The second meeting started around 5:30 p.m. and it was supposed to stretch for like 1 hour and 30 minutes. But seeing the scale of the concern that all the world leaders have expressed, the meeting extended a little more. And we know as of now that sources have told us that the major 4 concerns has been expressed, which has been expressed in this meeting, which has also been declared in this joint communique, was that how to deal with this COVID problem and its impact on the global economy. The 4 major points that the leaders have agreed upon were fighting the pandemic, and then safeguarding the global economy, and addressing international trade disruption, and at the same time enhancing global cooperation. So we know, and also there has been consensus among leaders that how to deal with this problem in a concerted effort, creating funds and in ensuring that the World Health Organization bodies who does most of the R&D work on this health pandemic thing, they need a lot of fund and a lot of research work that are going around the globe separately. So all those research work should collaborate in order to create one medicine or some vaccine which can prove successful in fighting this coronavirus thing. One thing was also clear that this whole meeting, this G20 virtual summit, which is unprecedented of its kind, that it has never had. We never have had such a virtual meeting of top 20 world economies at such short span of call. And this was also because the Prime Minister had this idea and he passed on this idea to Saudi King. We know that last week Prime Minister had a call with Saudi King, King Salman. And there from this idea emerged that the world economy should come together and deliberate upon the issue and how far its implication would go and what can cause this implication.
Also, in terms of mitigating the overall global economic slowdown, the implications in the times to come, because Abhishek, financial institutions like World Bank, WTO, United Nations also, in fact, besides others, also participated in this comprehensive virtual G20 meeting, which was, in fact, not only confined to the G20 grouping, but other countries like Jordan, Spain, Singapore was also part of it. So it's gone beyond the G20 narrative.
Yeah, exactly. And, the world leaders, especially Prime Minister, in his, the commentaries that he has made there, he tried to bring out the voices of those people who were not present in the meeting, like countries, smaller countries, underdeveloping world, who are at the major risk of this pandemic, because once this pandemic spreads in those poor and underdeveloped countries, the containment of this whole highly contagious disease would be a lot more difficult. So far, we know that countries like Italy, UK, US, Spain, they have a better infrastructure of healthcare system, and though it is unimaginably painful and uncontrollable in these countries also, but still they have world's best health infrastructure. So imagine the kind of pandemic that is spread across those underdeveloping countries where they don't have the means to fight this problem. And what would be the scenario? So Prime Minister tried to bring out those concerns also here at this platform of G20. The countries agreed that worldwide, separately, they are spending beyond $5 trillion of special funds to fight out this coronavirus problem. So there can be some major fund where every country will contribute.
Yes.
And it will be spent to fight this problem. Prime Minister's initiative of bringing together the regional, countries and neighborhood countries and making it start with special fund was also well appreciated during this G20 conference.
Right. Yes. Thank you very much, Abhishek Jha, for putting us this in larger perspective. In fact, moving on back home, today's centre has asked state governments to deploy additional medical facilities and fiscal resources for fighting COVID-19. Let us now take a look at the latest data regarding spread of coronavirus in India. Well, the total number of active cases of COVID-19 in India have risen to 633. We have the tabular format simplified for you on our screens. 16 deaths have been reported so far due to coronavirus in India. 44 people are undergoing treatment. They have been cured and discharged from hospitals. Number of those just discharged or cured are 44. The highest number of cases have been reported from the two states, Maharashtra and Kerala. In fact, Union Health Minister Dr. Harshvardhan held a video conference with all states to review the level of preparedness. Cabinet Secretary also held a video conference with Chief Secretaries of all states to review the implementation of the lockdown measures on ground. Preparedness of states was also discussed. Availability of essential commodities and services was also reviewed. NIMHANS in Bangalore has been asked to create awareness related to mental health issues that may arise in such trying times.
स्टेट में हर शहर में कोविड को डेडिकेटेड एक्सक्लूसिव हॉस्पिटल्स बनाएं, पर्याप्त मात्रा में आइसोलेशन बेड्स को उनकी उपलब्धता को सुनिश्चित करें, पर्याप्त मात्रा में आईसीयू के बेड्स, वेंटिलेटर्स की उपलब्धता.
Dr. Harshvardhan has said that the lab facilities have already been expanded and more than 20,000 collection centers are functional in the country.
लैब की टेस्टिंग फैसिलिटीज़ हैं वो तो हमने पिछले समय में बहुत एक्सपेंड की हैं। जहां 15 लैब से शुरू किया था, आज 119 लैब्स तो सरकारी ICMR की सहायता से, और इसके अलावा लगभग 25 प्राइवेट लैब्स, और जिनके आगे 20,000 से ज़्यादा कलेक्शन सेंटर्स हैं देश में। वहाँ हमने सारे टेस्टिंग के प्रोटोकॉल्स और जो टेस्टिंग के लिए जो उपलब्ध करानी है, किट्स इत्यादि, वो सब उनके लिए उपलब्ध कराई हैं।
And in order to firm up its efforts to fight coronavirus and also as a huge relief for the country today, Finance Minister Nirmala Sitharaman announced financial package to the tune of rupees 1,70,000 crore under Prime Minister Garib Kalyan scheme, and this is for the next 3 months. Now, there was a press conference today. She said the government is doing all it can. In fact, let's listen into Finance Minister first.
A package which will immediately take care of the concerns, the welfare concerns of the poor and suffering workers and those who need immediate help. So the package that we come up with will benefit those migrant workers, those poor, those urban and rural poor, and the women. And this Prime Minister Garib Kalyan scheme that we want to come out with is expected to meet a total of 1,70,000 crores.
Finance Minister also said the government is doing all it can to ensure that no one goes hungry during the period of lockdown. Several measures that you see on your screens were taken up, have been taken up via DBT, that is direct benefit transfer. In fact, rupees 50 lakh insurance cover specifically for healthcare workers who are at the forefront of dealing with coronavirus pandemic has also been announced by the Government of India. Farmers will also get support under Pradhan Mantri Kisan scheme or PM Kisan scheme.
The PM Kisan Yojana, Kisan Samman Nidhi, through which they get their annual 6,000 rupees. We will now be giving the first installment of that as a front-loaded matter, so that even at the beginning of the year, they will get 2,000 rupees. This will benefit immediately 8.69 crore farmers, 8.69 crore farmers will get immediate benefit out of this.
Daily wagers will get several benefits under Manrega. Nearly 5 crore families will be benefited in this. An increase in daily wages from rupees 182 to 202 has also been announced.
We announce a wage increase in Manrega. This will benefit 5 crore families, and the wage rate being increased will result in 2,000 rupees per worker. So 182 rupees is being increased to 202, and as a result we expect 2,000 rupees per worker will be the additional income he would get, and this will benefit 5 crore families.
Apart from this, relief under several other categories has also been announced today. Finance Minister maintained that Divyangs, widows and elderly will get ex gratia of rupees 1,000 in 2 installments for the next 3 months. Besides this, at least 3 crore poor senior citizens to be benefited from these schemes. All transactions in this regard will be done through direct benefit transfer route. Apart from this, 20 crore women Jan Dhan account holders will get ex gratia amount of rupees 500 per month for the next 3 months. At least 7 crore households to get benefited from this scheme, apart from 63 lakh SHGS. And for the next 3 months, 8.3 crore below poverty line households will be getting free cylinders for the next 3 months. Collateral free loan to the tune of rupees 20 lakh under Deen Dayal Antyodaya Yojana will also be rolled out. Also, collateral free loan has been increased from 10 lakh to 20 lakh rupees under this same scheme. Moving on, Union Home Minister Amit Shah also hailed the announcement of the financial package. Home Minister tweeted, and I quote, "The decisions taken by Prime Minister Narendra Modi ji today for every section of the country affected by corona epidemic, including poor, farmers, laborers, elderly, women, Divyangs. All this reflect the sensitivity of the Modi government. I thank Prime Minister Modi. Heartfelt gratitude to the Prime Minister Narendra Modi ji for the announcement of a relief package of rupees 1,70,000 crore under Garib Kalyan Yojana for relief from the global pandemic COVID-19. I also welcome the decision to provide health insurance of rupees 50 lakhs to all the warriors engaged in human services under these adverse circumstances. Unquote. That was a tweet from Home Minister Amit Shah. In fact, BJP Chief JB Nadda has also hailed the package announcement by the government. He has tweeted saying, and I quote, Honorable Prime Minister Narendra Modi's government has announced a big relief for the poor of the country in the hour of this crisis. It is our resolve that no one should sleep hungry. The government has announced a relief package of rupees 1,70,000 crore under Pradhan Mantri Garib Kalyan Yojana. Unquote. Uttar Pradesh Chief Minister Yogi Adityanath has said that steps announced by the Finance Minister Nirmala Sitharaman are critical and substantial to help the most vulnerable sections of the society through the immediate crisis. He has said India is the first country to declare any such relief package.
दुनिया के अंदर भारत पहला देश है जिसने अपने देश के गरीबों के लिए, किसानों के लिए, महिलाओं के लिए, श्रमिकों के लिए, छोटे व्यवसायियों के लिए इतना बड़ा राहत पैकेज लगभग 1,75,000 करोड़ रुपए का इतना बड़ा राहत पैकेज की घोषणा की है। मैं इस पहल का स्वागत करता हूं। आदरणीय प्रधानमंत्री जी का आभार व्यक्त करता हूं। लॉकडाउन की इन स्थितियों में इस देश के 80 करोड़ गरीबों, किसानों, महिलाओं, श्रमिकों, छोटे छोटे जो व्यवसायी हैं, जो प्रतिदिन कमाते हैं, इन सबको जीवन की एक नई राह दिखाएगा।
Health Ministry held its daily briefing today evening as well. 43 new cases have been registered in the past 24 hours.
अभी तक हमारे देश में टोटल 649 कंफर्म केसेस पाए गए हैं। उन केसेस के ऊपर एज पर प्रोटोकॉल हम रिक्वायर्ड एक्शन ट्रीटमेंट फॉलोअप कर रहे हैं। इसके साथ ही 13 डेथ्स भी रिपोर्ट हुई हैं। अगर हम देखें तो पिछले 24 घंटे में 43 नए कंफर्म केस आए हैं और 4 नई डेथ रिपोर्ट हुई हैं।
Health Ministry also maintains that there still isn't any evidence of community transmission. Spokesperson Love Agarwal said that strict implementation of the lockdown is extremely critical to prevent this community transmission.
अभी हम लोकल ट्रांसमिशन की स्टेज में हैं, जबकि हम पर्टिकुलर केस के साथ उस केस ने किसको इन्फेक्ट किया, जैसे आपने भीलवाड़ा का एग्जांपल दिया, तो एक डॉक्टर थे जिनकी ट्रैवल हिस्ट्री थी, उसके बाद उन्होंने अपने जब हॉस्पिटल में काम किया तो उसके साथ कुछ और लोग इन्फेक्ट हुए। 1 या 2 केसेस में अगर हमारे कॉन्टैक्ट ट्रेस नहीं होते हैं, मैं फिर रिपीट करना चाहूँगा, इसका तात्पर्य केवल एक है कि अभी या तो पर्टिकुलर उस पर्सन ने अपने आप को एनालाइज करके कि उसको कहाँ से इन्फेक्शन होगा, उसको हमारे को वो एक्सप्लेन नहीं कर पा रहा है। और साथ ही क्योंकि वो हो सकता है वो पर्सन 3-4 जगह ट्रैवल किया हो, उसने 1-2 जगह पर जो कॉन्टैक्ट हो जिसके बारे में हम ट्रेस नहीं कर पा रहे हैं, तो हम उसको क्लैरिफाई नहीं कर पा रहे हैं। कम्युनिटी ट्रांसमिशन के बाद जो लेवल ऑफ अलर्टनेस, लेवल ऑफ एक्शन और लेवल ऑफ इन्वॉल्वमेंट हैज टू इंक्रीज मच फर्दर। लेकिन जब हम इसके बारे में बात कर रहे हैं तो आई थिंक आज का मुख्य प्रश्न ये नहीं है कि देश में कम्युनिटी ट्रांसमिशन हुआ है नहीं हुआ है। आज सबसे मुख्य प्रश्न ये है कि क्या कलेक्टिवली आज हम लोग मिलकर इस बीमारी से लड़ने के लिए तैयार हैं।
In fact, all efforts are being made to ensure essential commodities and services are available across the country, and steps are also being taken to ensure food and shelter, specifically for migrant laborers as well.
लॉकडाउन पीरियड में एनफोर्समेंट के साथ साथ आपको एसेंशियल गुड्स और सर्विसेज में कोई कमी ना महसूस हो। स्वास्थ्य सेवाएं एवं एसेंशियल सप्लाईज, सर्विसेज और कमोडिटीज़ को सुनिश्चित करने के लिए राज्य सरकारों ने कई कदम उठाए हैं, जिनमें से कुछ कदम तो बहुत ही इनोवेटिव हैं। और भारत सरकार अपनी ओर से 24/7 बेसिस पर स्टेट्स और यूटीज़ की स्थिति को मॉनिटर कर रही है। जो हमारे माइग्रेंट लेबरर्स हैं उनके लिए शेल्टर और फूड की व्यवस्था हो। सभी लेवल्स पर हम बार बार सेंसिटाइज कर रहे हैं कि जो जहां है उसका वहीं पर सुरक्षित रूप से रहना उचित होगा।
The aviation regulator DGCA today announced that all international commercial passenger flights will remain suspended till April 14 amid a nationwide lockdown to prevent the outbreak of coronavirus. However, there will be no restriction on internal cargo flights. DGCA on March 19th, remember, had announced that no international commercial passenger flight operations will take place in India from 1:30 a.m. on March 23rd to 5:30 a.m. on March 29th. Now the government has suspended domestic passenger flight operations from midnight with effect on March 24th. News coming in from Jammu and Kashmir, 2 coronavirus infected cases have emerged. This includes 7-year-old brother and 8-year-old sister were tested positive. Their grandfather, in fact, had recently returned from Saudi Arabia, who was also tested positive. 11 cases of coronavirus have been recorded only from Jammu Kashmir. Jammu Kashmir police have arrested 31 people in Kashmir Valley for violating prohibitory orders imposed under the lockdown to prevent the further outbreak of the coronavirus there. Meanwhile, Northern Command Headquarters is taking all precautionary and necessary steps to safeguard the troops from coronavirus infection. The command is setting up quarantine facilities in different places of Jammu, Kashmir and Leh, and not only at army hospitals but at all unit levels as well. From checking flu symptoms among soldiers on their return from leave to cancelling non-essential travel and conferences, Northern Command says it has taken a series of precautionary measures to prevent the coronavirus spread among the forces. Now, all units are following standing orders to save soldiers very strictly from the COVID-19. In fact, you can hear those announcements that are being made. They're on the mission Corona Mukt Awam now in Jammu Kashmir, and here you can see the army jawans we just showed you, in fact, on your screens a while back. Yes, these are those visuals, army jawans there appealing to localites, the Kashmiris there, and these are the visuals that have come from Soibag and Badgam district, requesting localites to stay home and safe. From Jammu Kashmir, moving on to Maharashtra, where all shops selling essential commodities, groceries, medicines are allowed to operate 24 hours. It is mandatory for them to fully adhere to social distancing measures, however, enforce gaps with markings and ensure sanitation and cleanliness. The centre has capped the maximum retail price of the 3-ply face masks made of meltdown non-woven fabric at 16 rupees per piece till 30th of June. Consumer Affairs Secretary Pawan Agarwal says that the rate of 16 rupees per mask has been fixed after holding consultations with the mask manufacturers. He said the decision will ensure adequate availability of these masks. On 21st of March, the Consumer Affairs Ministry had notified maximum retail price for 2-ply at 8 rupees and 3-ply, surgical masks at 10 rupees per piece. Agarwal also said that efforts are being made to ensure sufficient supply of these face masks that you see on your screens and hand sanitizers that are available in the current situation. Let's now take a look at the Sensex. The equity benchmark Sensex jumped over 1,411 points to settle at 29,946, while Nifty soared 323 points to close at 8,641.45. The Indian rupee is appreciated by 13 paise to 75.81 as against the US dollar. And Prime Minister Narendra Modi continues to share videos and messages from people from all walks of life related to tackling the challenge of COVID-19 on Twitter. In fact, now we're going to show you one more such message from India's youngster or youth, showing the way when it comes to ensuring healthier tomorrow. Prime Minister Modi asks, will you pay heed to what our youth have to say?